Neurosurgeon Dr. John Bukvar.
It's important to recognize the amount of blood that he had in the brain, and that's an unnatural event. What that means is he essentially has irritation of the lining of the brain caused by the blood product, and that essentially is an inflammation. As if he hit his thumb with a hammer, his brain has been hit with a clot of blood. You know, I think he does, like you said, fall into that category of patient that is lucky. He had a brain hemorrhage, something called the subarachnoid hemorrhage, and he's one of the lucky 10 or 15% that actually gets out of the hospital early.
You can take the tumor out, and a couple days later, those cells are dividing and dividing until it regrows. We've devised a mechanism to break down that barrier and infuse the brain tumor with these drugs. And I can get a 50-fold concentration boost to the tumor and spare a patient systemic or side effects from the intravenous or traditional routes. The way I describe it is if you have a hornet's nest and you want to kill all the hornets and you spray the nest, some of those hornets will get out before they're killed by the spray. We have a spray, and now we got to get an additional treatment that may prevent those hornets from coming back.
Is it possible he plays football again?
No.
Is it possible he walks again?
It is possible. It is possible that he walks again. It is unlikely. Thankfully, he's a very fit young man who's a thin young man, and that helps my surgery quite a bit.
She can walk literally within, 2 or 3 hours.
The mutations in the breast cancer allow us to not only give advice to the patient, but obviously to give advice to the patient and their family, daughters, sisters. When I put the catheter in the brain and his pressure in the brain was relatively normal for this kind of fall, it is truly miraculous. We open the gate, and we literally spray the chemotherapy agent onto the tumor. Once you get the diagnosis of a malignant brain tumor, the standard treatment includes radiation therapy and chemotherapy, with or without surgical biopsy or surgical resection.